Good morning. Today we'll be discussing lovenox education for a patient that will be self-administering lovenox at home, being sent home with a self-teaching kit. In this discussion, we will have three main points. The first point is what is lovenox and why it is important for this patient to learn about it. The second point will be the actual injection. This will include the preparation, the supplies needed, the injection itself, and the disposal of the needles and syringes used in the injection. The third and last point will be side effects and complications that can occur and what to do about these. What should we look for and how will we deal with these should they arise. Today I will be using the education with Stephen, a patient that was discharged. Hi Stephen, how are you?
Good.
So you've been discharged with lovenox, is that correct?
Yes.
Okay. The reason you were discharged with lovenox is there's a group of people that are a higher risk for developing a DVT. A DVT is a special blood clot. It's a deep vein thrombosis. A deep vein thrombosis can turn into a PE, which is a blood clot that travels to your lungs. The people that are at most risk for this are people that have had certain abdominal surgeries, knee or hip surgeries, or just might be immobile for a long time due to a prolonged illness. In your case, you just had a knee surgery, is that right?
Yes.
Okay. So the doctor discharged you with this lovenox teaching kit. In it, you'll find there's a DVD, there's a lot of useful information, and to refresh yourself, okay? There's an in-depth handbook. There's a lot of information in here. There's a sharps container to dispose of your needles and syringes that you use. And there's alcohol swabs. Okay. So do you understand why you have lovenox and why it's important for you to keep up the regime?
Yes.
Okay. We'll move on to the injection then. So you want to be first you want to wash and dry your hands thoroughly each time, and you've done that already, is that right?
Yes.
Okay. The second step is to be comfortable. Either lie down or recline sitting in a position where you're able to see your abdomen.
Okay.
Okay. So you want to be able to see your abdomen around your belly button. And you want to choose a spot that's at least 2 inches away from your belly button on either side of the belly button. And take the alcohol and cleanse the area that you chose. And the reason you want to choose a spot in your abdomen is that the lovenox is absorbed much more readily into the fatty tissue in the abdomen. Okay, so we'll let that dry. In your writing hand, take the syringe. Okay, with your other hand, go ahead and pinch an inch of the area that you cleansed. Now go ahead and insert the needle at a 90-degree angle all the way. Push the plunger until it's empty. Pull it back out, okay, and let go of the skin. Now you want to dispose of it into the sharps container, keeping the needle away from yourself or anyone else. Go ahead and close the sharps container. And since this is able to be closed and sealed, you can dispose of it safely after you've completed your entire lovenox regime. Okay? So how do you feel about injecting? Do you feel that, are you comfortable doing this at home by yourself?
Yeah.
Okay, great. Now, there are certain things that you need to watch for since you'll be doing this at home by yourself. There are some side effects and complications that can occur. There are some mild ones, and they're common, and they're okay. You don't have to seek help. Now those would be, you could develop a mild fever, some slight swelling in your hands and feet, or a little bit of nausea, diarrhea. Those things are okay. The things that are important to watch for, lovenox, since it is an anticoagulant, it alters the ability of the blood to clot. So unusual bleeding is a big side effect. If you see that you have any unusual bleeding from your mouth, nose, or rectum, if you cough up or vomit bright red blood or a coffee ground substance, that's important to notice. If you develop numbness or tingling in your feet or lower extremities or muscle weakness, if you find that you're easily bruising or you have little red pinpoints under the skin, any of these things would be to stop taking the lovenox right away and to call your doctor. Do you understand those things?
Yes.
Okay. Now, the most emergent thing would be an allergic reaction. So if you find that you're developing hives, if your skin's burning, or if you have any swelling in your hand or your face or your lips, get emergency help right away. Do you understand?
Yes.
Okay, great. So are you comfortable with your regime at home?
Yeah.
Okay. There's in-depth material, like I said, on the book. Please review it, and the DVD if you need a refresher. In summary, today we have taught Stephen self-administration of lovenox at home. We have talked about what lovenox is and its importance to him, some common side effects, and the injection itself. Thank you.